PD-1, PD-L1 inhibitors have been approved in an expanding list of malignancies. And at the present time, they are given on a continuous basis until disease toxicity or progression. Immune-related adverse events are a class effect that are associated with these agents, which basically are side effects resulting in immune system overactivation. So what we did in this study was actually analyze the outcomes of PD-1, PD-L1 therapy responders who actually had to discontinue therapy for immune-related adverse events. We conducted a retrospective analysis conducted at 5 different institutions and identified 19 eligible patients. And the patients were actually categorized into whether they were durable responders, meaning they were able to remain off treatment with controlled disease for over 6 months, immediate progressors, meaning that their disease started to advance or progress within 4 months of them stopping treatment, or other. And most of these patients had an average age of 68 years. They were male, most had clear cell histology, most had received prior therapy and undergone a prior nephrectomy. About 26% of patients had poor risk disease, and the majority of patients, 58%, received PD-1 monotherapy. What we found was actually that 42% of patients were classified as durable responders, meaning that they were actually able to remain off therapy with their disease controlled for over 6 months, though their treatment was discontinued. PD-1, PD-L1 targeted therapies are associated with a certain subset of side effects that are unique to the spectrum of chemotherapies and agents that oncologists classically use in their treatment armamentarium. And so understanding how to manage these side effects, and also understanding that though therapy may be discontinued, that there are actually a subset of patients who can continue to benefit from the immunotherapy that they may have received and may not necessarily need any additional therapy to control their disease. So it's a new era that we're operating in, as opposed to dealing with some of the standard chemotherapies and the standard chemotherapy side effects. So I think as we think about these immunotherapies getting approved, I think there's a wave of trials that are immunotherapy plus trials of looking at immunotherapies being used in combination and immunotherapies being used in combination with other immunotherapies or in combination with VEGF targeted therapies. I think a trial that I would like to mention is the phase 2 omnivore study, which is actually looking at evaluating discontinuing therapy in patients who have a response. So kind of optimizing and personalizing the management of immunotherapy for patients who receive these drugs.